Welcome to Gutsy Talks. I'm Rachel Larson, your host, naturopath and nutritionist, and I'm here to have real, honest conversations that can help you heal your gut, calm your mind, and fall back in love with food. Together with leading health experts, we'll dive into all things gut health and explore the deep connections between your gut and overall well-being, so you can feel empowered to take control of your health and live your best life. If you love all things gut health, follow me for more on Instagram at rachel.larson or head to rachellarson.com.au. Now, let's get into today's episode. Today's guest is Isabella Lees-Trinca, a passionate and skilled physiotherapist specialising in pelvic floor rehabilitation and gut health. Pelvic floor health is hugely overlooked but vital and part of the gut health puzzle. It affects how we poop, manage tension, and regulate digestion. Yet it's rarely part of the conversation for those with gut symptoms. With a deep clinical experience in pelvic health, Isabella helps people overcome issues like incontinence, pelvic pain, bladder dysfunction, and bowel symptoms. Her mission is to bring lasting relief by treating the often ignored link between the pelvic floor and gut function. If you're someone you know is struggling with bloating, constipation, IBS, or just any other gut issue, this episode is a must. So welcome to the show, Issy.
Thank you. Thanks for having me, Rachel.
Oh, it's been a long time since we first met. Like I reckon a good 8+ years ago.
Probably 8, yeah.
Yeah, it's been a hot minute. So I'm so glad to have you here because you're someone that, I know you're super busy in clinic and you're not working 5 days a week at the moment. So I know your capacity is, probably not that much, but I'm always saying to people, go to Issy, go to the clinic. You need to have a pelvic floor assessment because it's just such a big part of what I'm dealing with in my clinic, which is gut issues.
Yeah, which is so common. Common.
Oh, totally. So again, when I was introducing you, as I said, it's a really unrecognized or just, under kind of valued part of our gut health issue, which is the health of our pelvic floor. So for people that are kind of like, what are you even talking about? Like, what is our pelvic floor? Can you kind of just explain what the pelvic floor is?
Yeah. So the pelvic floor exists in both men and women. I think a lot of people think it just exists in women, but we all have muscles in our pelvis that support our pelvic organs. So they are the muscles that go around that saddle area. You imagine sitting on a horse, that bit that's on the saddle, your pelvic floor is. They go from your pubic bone all the way around to your coccyx, and they are holding in your bladder. They're holding in your uterus if you have a female body. They are holding in your bowels for everybody, and they are also helping with our bladder function, with our bowel function, and with our sexual function for men and women. So hugely important. We use them every day, and often we forget about them because they just kind of do their thing, but they can often cause trouble. So,
and that's so funny that you had to actually say it's in men and women, and obviously anyone that identifies anyone else, every human, because you often only think about pelvic floor when it comes to postpartum or incontinence, urinary incontinence. And I guess this is kind of why it's not really looked at when it's gut health, because there's just this bias between what pelvic floor physiotherapy can really assist with. So can you please explain to us the link between our pelvic floor and digestion, kind of gut health? Like, how is it working and how is it influencing it?
Yeah, for sure. So your pelvic floor muscles essentially hold in things all day long. So they hold in your poo, they hold in your wee. When you need to urinate, when you need to open your bowels, they have to relax so that you can pass things out properly. So if you can't relax them properly, then you often can't get stool out properly, which can then lead to constipation or a buildup of gas, bloating, that kind of thing. There's a couple of different layers of the muscles. So we have layers at the anus level. There's little circular muscles that they're called sphincter. There's 2 layers of those that kind of hold it. They're like the very last backstop. So when you are really busting, those are working overtime.
Yep.
Some of them are involuntary and some of them are voluntary squeeze. So, when you're trying to hold on to a fart in an elevator, those muscles are working really hard.
Everyone's like, yes, I know that muscle.
Yes, exactly. Everyone knows that muscle. And when you look a bit further up, our rectum is actually created by a big tube, and then there's a big muscle like a lasso called puborectalis, so it goes from the pubic bone around the rectum like a horseshoe shape, and that one holds stool back and kind of kinks off our rectum so that it's kind of at an angle.
Mm-hmm.
When we defecate, that muscle fully relaxes and stuff can come out. If that muscle doesn't fully relax, then stuff can get stuck behind it. And then that builds up, and then that can build up constipation. So if you get stool sitting there for long enough, it dries out. So the longer the stool sits in your bowel, the more fluid drains out of it, and the harder and drier it becomes. And it just sits there like a little plug, and then everything higher up slows down, and it can even develop to the point I've got patients who they're so blocked up and such slow gut that they've got reflux and digestion issues higher up as well in the esophagus and the stomach. So it can
Mm.
really slow things down.
Wow.
That's kind of it in a nutshell. And then at the same time, I guess you can have the opposite, which is having really weak pelvic floor and then leaking stool or rushing to the toilet and not being able to make it in time or only just getting there in time.
Yeah.
Um, some people just have urgency all the time with their IBS because they've got constant runny stools and that's really hard to hang on to. So they're kind of, those muscles are working overtime.
Yeah. Well, that and like that makes so much sense because, and this is why we needed to talk about it because you're mentioning like anatomical, changes and issues, whereas people still think that, gut health and constipation, I guess just using constipation example, is still a case of fiber and water intake. And
Right.
I guess obviously what you're saying is that there are other issues at play, like the
Really.
the tone of these muscles and how they're working, getting signaled that
Yeah.
influence, constipation as well as other things. So I think like if you're someone that's like, I cannot eat another gram of fiber or drink another liter of water,
Yes.
it's like, yeah, you probably can't. It's probably
Which is
something
so
else.
true. And I
Yeah.
think so many of my patients come having had a couple of years, maybe sometimes even longer of symptoms. And so they've done all the things, they've done all the fiber, they've done all the water, they're eating perfectly, they've done a low FODMAP diet often as well. They've got their most clean, beautiful diet. They eat way better than I do. And they're still having symptoms. And I think it's definitely not the food or water that you're eating now.
No,
It's something else going on.
absolutely. So tell us, I guess you mentioned some of the signs that people may be experiencing that might suggest that there's a pelvic floor issue involved. What are they?
So I think one of the most common ones that I see is people who come in saying, I just never feel like I've had a complete bowel movement. It always feels
Yes.
incomplete. It's that feeling of like I never feel satisfied after a poo. There's always something left behind. Either I feel it further up in my stomach or I feel it right down in my bottom. There is still poo sitting there and I
Mm.
can't get it out. That's a really common symptom we see a lot. So that's a definite pelvic floor is causing something. If you can't get it all out, particularly if the stools are normal, but you still can't get it all out, that's definitely. So if you've got normal soft sausages,
Yep.
and it ruins sausages for a lot of people, that are just not coming out properly, that's definitely a sign. If you have hard, dry, pebbly stools and you can't get them out properly, that's probably a sign of poor fluid intake. But it can also be, as I said earlier, if you don't get everything out, things can dry up further up, and you can then get dry stools. So it can
Mm.
be both. If you go from one extreme to the other, if you go from constipation all the way through to diarrhea some days, and you're going from one extreme to the other, that often is gut stuff that we can help with. And then I really see a lot of those people who have irritable bowels where their stools are just coming way too frequently. They're
Yep.
going way more than 3 times a day. So the normal range is quite large. It's up to 3 times a day, as little as 3 times a week is a normal amount of times to poo. So that's a pretty big range of
Yeah.
spectrum. That's normal. Someone's going more than 3 times a day, or when they do go, if they're busting to go, that's a sign. Certainly any leakage. So if there's any leakage of stool, any leakage of wind, can't control those things, or you feel like you're often only just making it, that's something that's definitely pelvic floor related.
Mm.
Then, I see people who have trouble with their bladders as well. So it's really common if you've got a really build up bowel full of poo that your bladder then gets a bit squished and then you're having to wee frequently or you're busting or you're leaking wee. That's really common too.
Mm.
I see a lot of women, men and women with pelvic pain. So if
Yes.
you've got pain with sex, that's something pelvic floor related, most
Yep.
likely. Pain with anal sex, pain with vaginal sex, any kind of issues with erections can often be pelvic floor related as well. Arousal dysfunction as well for women as well.
Mm.
All those kinds of things can be pelvic floor related sometimes. And then prolapse is another word that people hate hearing, but
Yes.
for both men and women, you can get prolapse of the rectum.
Yeah.
Actually, is tissue coming outside of the anus or hemorrhoids that are bulging out. So that's a really common, not uncommon thing to have.
Yeah.
And then plenty of women after childbirth have prolapses of their vagina. So coming from their bladder, coming from their bowel, coming from their uterus, just coming down a little bit. And that
Yeah.
can cause trouble with emptying the bladder or emptying the bowel. Or it can make them feel like they've got heaviness in their vagina or bulging in that area.
Mm. So it
So,
kind of feels like a lot of people could probably do with a bit of an assessment.
okay.
And it's not
Yeah.
to say like everybody needs an assessment. I think it's more about like keep it on your radar. though,
Give
because
it a If you think it's something that might be affecting you, give us a call. We can tell you if it is or not. We're
yeah,
in.
because it's such a shame because obviously we're going to get into, what people can expect in an assessment and, different types of, I guess, treatments and supports that can occur because really with this stuff, there's a lot that we can do. So even things with prolapses or tight and weak muscles, like these aren't necessarily forever things. They're things that that you can have a lot of improvement in how things are functioning with physio. So, for people that are hearing this, like this is a episode of like hope, really, that we're saying like, hey, this is probably like a missing piece of the puzzle, could have significant benefit in your life.
Yeah.
Like, listen up. So, you mentioned a lot about like the defecation aspects with the constipation and diarrhea, and that makes total sense. You also mentioned as well that bloating, is a symptom that you can get with pelvic floor as well.
Yeah.
Because I deal so heavily with bloating, I'm just wanting to see is what you're finding in your clinic that bloating is related to pelvic floor in a sense that there's the constipation creating a plug, or are there other things that are happening that could be influencing the degree of bloating someone's experiencing?
No, there's definitely other things as well. So that is definitely one factor, constipation causing bloating for sure. But there's lots of people who are not constipated that have bloating,
Mm.
heaps. Um, there's a really interesting phenomenon called dyssynergia, like a diaphragm it's called abdominophrenic dyssynergia. It's when the abdomen, so the tummy and the diaphragm don't work in symmetry. And so essentially, the diaphragm's a giant muscle under your lungs that controls your breathing. And it also massively affects our digestion and bloating. So it's like this huge muscle sitting under our lungs and it moves down as we breathe in and it moves up as we breathe out. Often, when people get bloating, they don't even realize that they're swallowing air when they're eating. This happens
Mm.
particularly when we eat too fast, when we're drinking through straws, chewing gum, um,
Carbonated stuff.
carbonated drinks for sure, doing lots of like just breathing in a stressed state. So often stress is a factor as well. We just change our breathing pattern. And so we're not completely exhaling over the day. And particularly this is true of the people who say, I wake up and I'm fine, but as the day goes on, I get more and more bloated. So by the end of the night, I've got this huge balloon and I look like I'm 9 months pregnant.
Mm.
They often got this disconnect where their diaphragm is not moving down and creating some space and moving up to create space in their gut. And the pelvic floor and diaphragm kind of work in symmetry. So when the pelvic floor is relaxed, the diaphragm can move down with it and they kind of move up and down together.
Mm.
So often when there's a really tight pelvic floor, the diaphragm will kind of squish in as well. And it's essentially like having a Coke can and squishing it from the top and squishing it from the bottom. If everything's really tight and not working properly, it's going to push out the front.
Yeah.
So I think often like really nice diaphragmatic breathing, abdominal breathing exercises, working on relaxing the muscles in the tummy can really help with bloating.
Mm.
That's not to say there's often people have got excess gas in their tummies from food intolerances or from other gut issues
Yes.
like SIBO, but which you obviously would know a lot about. That's when I handball back to you. But certainly the diaphragm, probably even more so than the pelvic floor, can contribute to bloating.
But and that's what we need to also know about because again, people think it's the SIBO, it's the food intolerances, and yes, it would be,
It
but
can be those things. I think sometimes it's multifactorial. There's
I
multiple things going on at once.
always is. I
Yeah,
have people that I'm handballing to you, being like, I know they have SIBO, I know they have food intolerances, but there is something missing, and this is what we just need to understand. And it's interesting that you mentioned breathing and how we breathe. I did a podcast that's already out with Bim Beam, and she's a Buteyko breathing instructor, and great in the naturopath world. And talking about that diaphragm and how we breathe. And it's again the simple things that we're doing that can make such a difference that we're not conscious of because we're all stressed little bunnies running around not breathing properly. Like
totally.
it's gonna have an impact. So I'm glad you mentioned that because this is like linking different podcasts together and I guess also giving a sense of how holistic we need to be approaching our health. I wanted to chat about, I guess, tight and weak pelvic floors. I think people
Oh,
make the
yeah.
assumption that, I'm constipated, it must be weak. Or, like people just kind of,
Yeah.
so like what is going on with tight and weak? And does it necessarily mean you have to have a certain type of symptom picture? Or is it not really that straightforward?
It's so not straightforward. It is complicated, actually.
Yep.
I would say most people I see have got what we call like an overactive pelvic floor, like an overachieving pelvic floor that just wants to be on when it doesn't need to be, wants to be tight. So it's a postural muscle. They're meant to be on a little bit all the time, just to hold, as I said earlier, to hold in our wee, to hold in our poo. They don't need to be super tight all the time. They don't need to be when we're like fully, gripping on all the time.
Yeah.
And this comes so much hand in hand with stress and anxiety. I see so
Yes.
commonly people who have really tight jaw muscles, really tight neck, and then a really tight pelvic floor. It's all tight because they're stressed and their muscles are just taking on that in a different, maybe they don't feel stressed, but their muscles are taking it on for them.
Mm.
So it's really common to have tension, and that means instead of being able to move through its full range, so be able to completely relax, be able to completely contract, it's kind of always on a little bit, and it might come up a bit further, and then it might only relax part of the way.
Yeah.
So it's a little bit like if you spent all day long doing bicep curls only from a short range, like only from when your elbow's bent to being all the way bent and not ever making it completely straight, never
Yes.
straightening your arm. You'd get this really tight, possibly sore muscle. It doesn't have to cause pain, but it can cause pain. That just doesn't have its full range. And then actually that can cause weakness because it's not got its full capacity. So
Yeah.
sometimes they're weak and tight at the same time, which is a
Yeah.
really bad combo.
Yeah.
We see that particularly in people who perhaps have had babies and then everything's felt kind of loose. So they've gotten really good at holding on all the time,
Yes.
but then they're not great at letting it go. And then it's kind of weak and tight. And it's got this bad combination of maybe there's a prolapse, but the pelvic floor muscles are also working overtime to try and support it. And super complicated.
Oh, our poor little muscles trying so hard
Yeah,
for us.
they're trying really hard. They're doing their best, but they are so, and I think with the stress response as well, like if we think about it from an evolutionary perspective, like as a species going through the eras, we were trying to protect that area because that's our genital area. That's our way of recreating more life.
Yeah.
So I think our bodies, from a primal level, actually really go into protection mode in that part of our body
Mm.
and like really switch on when we're stressed. It's like I've noticed myself, even if I'm in traffic and I'm driving and I'm getting late for work, I can be like, oh, I'm really like grabbing my muscles and like not letting them go. And I
Yep.
have to be conscious of letting them go.
Yep.
So it's so people who have leakage aren't always weak, and people who have constipation aren't always overactive, but it's a spectrum of a bit of both often.
Wow. That makes just so much sense when you're explaining it about how, especially that bicep curl, where it's almost so strong and tight, it's in a sense also weak at the same time, which is
And it can
why
get fatigued because it's been on all day long. Then when it needs to work harder, it's like, I'm knackered,
nothing in the tank, I can't do
nothing in the
anything.
tank. Yeah,
And I'm really glad that you mentioned the connection between the nervous system and our gut because every single thing that I'm talking about, there's always a nervous system connection. And I don't say it to be like, oh, it's just stress and anxiety. It really is, though, to put them as a priority in terms of our health, whatever we're dealing with, because the way that they are affecting us really is so multifaceted. So that when my patients, when working together, we don't have a conversation or we don't have an appointment that isn't without talking about it. But it really is just to highlight the different ways that it's affecting us. And for some people, this will be the thing that makes them think, right, I need to actually start supporting myself and my nervous system a bit better because it is actually affecting my pelvic health. Like, sometimes this might be the conversation that they have to think, right, maybe I am a bit more stressed and anxious or whatever it is, more than I thought. I also wanted to ask about, so that I guess can be a bit of a risk factor. And I'm assuming traumas from a physical and emotional sense can contribute to pelvic floor dysfunction. I guess, can you
absolutely.
explain that a bit more? But also, what are some other risk factors for pelvic floor dysfunction?
Yeah, sure. So it's funny, last night I was looking at some new articles that one of my colleagues sent me, and there was an article about pelvic floor physios and being trauma informed in their care because 20% of our patients will have a trauma background.
Oh,
20%,
wow.
which whether that's sexual trauma or childhood traumas in other ways, it's so, so common. And I
Mm,
think possibly even more in gut health.
yeah.
They're very, very strongly linked. Um, so, I mean, yeah, as I said earlier, that part of the body really goes into protection mode when there's trauma. And it doesn't have to be a sexual trauma or a physical trauma to that part of the body, but even just other stresses at work, bullying at work or a lot of my patients, their issues started when they're in high school and they had issues at school and that kind of thing. And it just, pressures of school, starting uni, all those kinds of traumas that we go through as well as young adults.
Yeah.
Um, our body can just come into this kind of protection mode of I'm just going to tense everything up very subconsciously. It's not something people consciously go, oh, I'm going to tighten my pelvic floor because of this.
Yeah.
It's extremely subconscious. It's extremely common, unfortunately. There's actually an awesome book called The Body Keeps the Score. I'm not sure if you've heard of it.
Oh, yeah, yep, I have. I've
Heard
not
of
read it, but I
it?
definitely have heard of it.
Yeah, The Body Keeps the Score is all about how trauma affects us physically and how we can have physical manifestations of trauma.
Yeah.
So, really great book for anyone who wants to kind of delve into it a bit further and learn a bit more about it. It's a really good book to read. A bit heavy, but it's good.
Of course.
I think, yeah, so most pelvic floor physios have done some trauma-informed training and are very aware of that because of how many of our patients have got some kind of trauma in their background.
Yeah. Oh, look, that's so worth noting that, like that's a great book. And again, like I think anything related to trauma, we probably go into the thinking probably not going to be a light read or a light, thing that I'm listening to, but like what a validating resource to have access to for us to kind of be listening and learning not only about our patients but ourselves if we're trauma
Yeah.
affected, and just to really see how common it is and how it does show up in the body. Like, yeah, I just think like that was, I'm so glad that you mentioned that, and that resource, because I think a lot of people, and we'll put it in the show notes, it should be something that most people are probably getting a copy of at some point.
Yeah, yeah,
Yeah.
absolutely.
So tell us, like, we know, I guess, the symptoms and how it is affecting our digestive capacity. So, how is it like, what are you doing in a session? Like, what is happening in a pelvic floor therapy session when someone comes to you and they've got a range of symptoms? Like, what does it look like? Like,
Yeah,
I don't
great.
know. Yeah.
That's a good question. People often say, "How on earth did you end up in this area?" And like, what do you do? You're a physio.
Yeah.
It's become like I'm wearing my active wear because I wasn't sure what you were going to do with me today.
Yeah,
Oh, okay,
exactly.
nothing too physical. It's okay. Um, what I do is it's definitely a niche. So there's lots of physios out there who do shoulders and necks and backs and all that kind of stuff. And really, I've forgotten a lot of that stuff from my undergraduate degree. But
Fair enough. You're focusing on the important stuff in this
yeah,
area.
yeah. And then within pelvic floor health, bowels is definitely a niche again.
Yep.
So look, it's a really holistic appointment. We spend an hour with at least with our new patients to kind of really kind of figure out exactly what's going on. So the appointment starts with a really long chat about
Mm.
everything that's been happening for them. So when did your symptoms start? What are they? Can you describe the background of everything you've had in terms of treatments? Because often people see me after years of symptoms and they've had several other therapies they've tried.
Yep.
I probably see people who are at the end of their tether, like going, I can't deal with this anymore. But
Yep.
every now and then I get someone who's early on in their journey. But unfortunately, people tend to take a long time to get to us.
Yes.
So it's a long, nice, friendly chat about, okay, so what's going on for you? Obviously, talking about your weenie poo is really embarrassing. So I try to make it pretty lighthearted,
You
make a
gotta.
few jokes as I go,
Yeah.
I don't care. People tell me really intimate details, and sometimes I'm so sorry. This is so revolting. I'm like, it doesn't faze me.
No.
We're you hear it all day long. I talk about poo constantly. Doesn't
Yep.
bother me at all. I'm sure you're
No.
the same.
Oh, it is really such important information. So we're like, yes, details,
So what's
please
the
give me
color? What's the
more.
texture? All the
Yeah, yeah.
nitty-gritty stuff,
You
unfortunately.
can't gross us out.
No, you can't gross us out. If you feel uncomfortable saying it out loud, that's fine. We'll work ways around it. But most people eventually feel pretty comfy that they can tell me all that stuff.
Yeah.
We go through a big history of that, just all of our stuff. Then we also go through all other medical history because often there's other things going on for people. Medications. We do a big kind of evaluation of what's been going on mental health wise. I'm not a mental health specialist at all, but we have people we refer on to in our
Mm,
clinic, and externally as well. And most physios will have those kind of people around them where they go, okay, I think there's also some psychological stuff that needs to be worked on as well. So I'll refer you on to a psychologist or a gut-directed hypnotherapist or a psychiatrist or you're back to your GP for a mental health care plan.
yep.
So we just want to be aware of that stuff because there's such a big link there, as we've
Yep.
said. And then we go through, I always ask everyone, even if they're just coming for their bowels, what about what's going on with your bladder? Because sometimes people don't even realize that there's things that can be worked on with that as well.
Yep.
What's going on with your sexual function as well. So cross over those areas. go through a big history of what's happened to your body as you've lived in it. Even childhood, sometimes people's symptoms have started in childhood. Constipation in kids is really common. About 30% of kids get constipated at some point. So it's often childhood stuff as well. And then we kind of start talking a treatment plan. So often in that first appointment, I don't examine people too much. It might just be feeling their tummy, like just having them lie on the bed if they feel comfortable with it and having a feel of their tummy. Sometimes you can feel the poo inside people's tummy. It can be, I'm sure you've felt that too. I can assess their breathing and see where their breathing comes from. Is it coming all the way down to their bellies, or is it really much chest breathing? We look at posture. I ask people to show me how they sit on a toilet. So
Yep, fair enough.
just on a chair, fully dressed, they just show me like, okay, like, well, how do you sit on the toilet? Because often the posture can be it can be quite an effective thing to start working on.
Yep.
And that is often as much of a physical kind of assessment that's done in that first appointment, because I like people to get a bit of rapport with me. I want people to feel comfortable. Sometimes we might do an ultrasound. So we have a little ultrasound machine we can use to have a look inside their tummies.
Yeah.
Their bladders, have a look at their bowel. That's really low, low risk. It's no radiation with an ultrasound, so that's a really easy thing to do.
Yeah.
And it's pretty, pretty comfy. It's only on the tummy.
Yeah.
Some people want or need in that first appointment to have their pelvic floor assessed a bit more thoroughly. So we can do that with an ultrasound, or we can do that with an internal examination.
Yeah.
That's not something I often do in a first appointment, and it's something that some patients never have done. And it's something that some people need a lot of, and they're okay with that. It's always hugely important to have informed consent with that stuff. So we do that a lot. We kind of ask several times, are you okay with it? And we can stop at any point. What that involves is there's no speculum involved. There's no instruments. It's not like having a pap smear at all.
Yep.
For some women, it might involve me wearing gloves, using a bit of lubricant and feeling the muscles inside their vagina and checking for prolapse. Asking them to kind of bear down and show me what things look like when they're pushing, see what they look like when they're squeezing, see what they look like when they're coughing.
Yep.
Some people, it might be examining their bottoms. So actually having a look outside at the skin around the anus, looking for little fissures or tears in the skin, looking for hemorrhoids. That might then progress to doing an internal exam on their rectum. So that would involve gloves and a bit of lubricant and kind of feeling the muscles inside. Often people feel really uncomfortable about that, and that's totally understandable. But we don't usually push that at all.
Yeah.
And we also have this crazy technique, which is really effective, but people are often like, what on earth are you talking about? We have this thing called rectal balloon biofeedback. I don't know if you've heard of that, Rachel.
I actually think when we first met years ago, you were telling me about that, and I was like, tell me more.
I'm sorry, what? You're going to put a what where? I know. Yeah.
Yeah. Tell us, what is that?
Right. So this is, again, please don't think that every pelvic floor physio, that anyone listening to this podcast might go and see someone that they're going to put a balloon in your bottom. That's not necessarily what's going to happen. And it certainly isn't a first line treatment. But we have a technique called rectal balloon biofeedback. So if anyone wants to Google it, that's the full name. It involves a small balloon covered in lube, slid into the rectum just at a really shallow depth, only a couple of centimeters in. It gets filled up with a syringe of air. So we just connect a syringe to a little tube and fill it up with air, and we can check what their sensation is like. So as we fill the balloon, we go, okay, when do you start feeling something in your bottom? When do you start feeling you might want to go to the toilet? When does that become really urgent? And there are normal amounts of air for each of those things.
Yeah.
So someone might feel it really early and be going to the toilet when there's not much there, and then we can teach them, oh, actually, you do need to wait until it feels a lot stronger than that.
Yeah.
Or someone might be having leakage problems and they're not even realizing there's stuff there, and that's why they're leaking. So we can go, I don't even realize there's stuff there. So at the slightest inkling, you need to be taking yourself to the toilet. Anywhere in that spectrum. So it's kind of a test, as well as we can then use it as a treatment. We also then fill up the balloon to about 50 mils, which is like the size of a small stool, and it's covered in lube, so it's really easy to get out. And we tell the person, and they're lying on their side on a treatment table for this, draped so that they're covered.
Yeah.
Okay, now, can you have a go at pushing this balloon out? And we see which muscles are they using to do that. Are they using the correct muscles that we'd like them to use, or are they really straining and pushing and putting downward forces in the wrong way? Are they having trouble getting it out? So often people will say to me, oh, my stools come out really skinny. They look like a pencil when they're coming out of my bottom. That's a really good sign that you've got pelvic floor that's not relaxing properly, because it's just the opening is not wide enough.
Yep.
So sometimes the balloon comes out really skinny too, like it gets squeezed out and we see this thin balloon coming out and I go, oh, okay, you really are
Yeah.
that muscle wrong. So it's a very strong way for us to go, okay, without having to watch you on the toilet doing an actual poo,
Yes.
how does something come out of you and how does it look when it's doing that and what muscles are you using? And then we straight away use it as a treatment. Okay, so you're not doing it right. How about we work on this with your tummy? How about we work on this with your breath? How about we work on this with your bottom relaxing? Actually, it's got an 80% success rate at treating
Wow.
obstructive defecation, which is when there's something stopping the defecation. So that's when the muscles are not relaxing. So it's pretty good as a treatment. It's obviously kind of invasive. So I don't
Yep.
recommend it for everyone. And some people just get better with all the basics that I tell them verbally.
Yep.
And there's some people who their symptoms just persist and we do something like this and it's amazing because it really works. So
Wow.
I should preface this with saying, I should have said this earlier, we always check that the rectum's empty when we do this, so no stool comes out with it is a
We love.
clean procedure. It is not,
Look,
it's not a messy thing.
these are the things people are probably thinking, listening to. They're like, oh my gosh, how would they know that you don't,
Yes, we
follow
check that
through?
first. We
Yeah.
check that first. In the years I've been doing this for, I don't know, 12 years, I've never had anybody have a big mess on the table. So that just, I mean, people are really worried about that, understandably.
Look, you just explained so much that I even think for me, like I wouldn't know. I haven't been to a pelvic floor physio for my gut health issues. So while I know that you're probably not going to greet people and say, get up on the table, I think it's
Never.
really important to be like, what can people expect? It's something which, we're talking, like you said, about areas that people are easily embarrassed by. And especially if you're like, how do you push? You're like, oh gosh, do I really have to? Like these are things that you're like, oh, do I have to do this? But it is obviously done with a lot of consent, a lot of respect, that there is rapport in place. There is, modesty taken in mind. There's all the right things that you would expect, and nothing is clearly done without your consent. So for people who are like, I'm just afraid, I hope that that kind of explains that there isn't a need to be afraid because, you can still
Yeah.
feel nervous, but there's not a need to be afraid because you're working with people that understand all of this.
Yeah. I think also if you're listening to this and going, there is no way I would ever let anyone look at that part of my body, that's fine. We can still get people better without doing this stuff.
Good to know as well. Because yeah, they're going to be, I mean, part of me was like, is it weird that I'm like, I would love to try that because I mean,
That is weird.
the gut health nerd in me is like, oh, I wonder how, but again, it's just like, I know
I
that not
mean,
everyone's the
so
same.
I'll tell you something funny. There's a postgraduate course which I've done at Melbourne Uni for pelvic floor physios. So they're physios who have already done their normal physio 4-year degree or whatever, however many years, and then they're doing a postgrad certificate in pelvic floor rehab. And I tutor on that course, and it runs in at Melbourne Uni. There's a couple of other unis that run it, and we practice on each other doing all this stuff. So we're all very sympathetic to what it feels like because we have been the patient and we know what it feels like to push a balloon out. We know what it feels like to have 4 people watching us while we have our bottoms examined to learn.
That
They get
is,
examined on it, their exams. They have to perform this stuff on a friend often as an exam.
wow.
So they're very highly trained people and they also know what it feels like. So I can tell you, doctors and nurses do not do this stuff on each other. They do not have the same sympathy.
Yeah, no, you guys have got sympathy, empathy,
We've got all
all
the,
the
we're all across it. Too much, actually.
understanding more than probably what any other practitioner would have with any other procedure that they're doing. That is so good to know. So I guess it's kind of clear that we've been talking about it, that like a lot of people would benefit from seeing a pelvic floor physio. Are there any particular conditions where you see pelvic floor physiotherapy working really well? Like, is it great for your IBDs, IBS, or is it just kind of anyone with any kind of symptom that we've been talking about?
Really anything with a lower gut. So when I say lower gut, I mean bowel stuff rather than like reflux,
Yep.
tummy stuff, probably more like the constipation, diarrhea. So IBD, inflammatory bowel disease like Crohn's and ulcerative colitis, those sorts of conditions, those patients often have really frequent stools and really runny stools. And often I mean, in combination with dietitians and naturopaths, we will
Mm.
be prescribing fiber supplements if it's appropriate and working with their doctors really closely on what they can do to make their stools a bit more bulked up. And we might work on how they hold on to their stools and actually work on like how they contain it better and manage that sort of thing. And it's often, and in fact, one of my colleagues, Angela Kera, who's an amazing physio who has trained me essentially and works in the same rooms as me, she's done a PhD on pelvic floor physio for IBD,
Ooh.
and she's got great results. And that it's often overlooked because it's such a medical condition, but we really love helping people with those conditions because we can often make things a lot better for them. And it's
Mm.
a long-term condition. So it's nice to have stuff that makes things more manageable.
Yeah.
IBS, absolutely, all the time. And any other kind of bladder or pain or issues with that part of the body and that kind of vaginas, urethras, penises, any of that
All
stuff,
that stuff.
right, we'll do all do all of it.
Great. And that's good because, people would be thinking, do I, am I the right candidate to maybe explore this? And I think from what we're hearing is that, yeah, you likely are. If you're thinking you are, you probably are.
Yeah.
And I'm glad you mentioned that, especially about that inflammatory bowel disease link and practitioner is because people have been listening to the podcast or just know that ulcerative colitis runs heavily in my family. I've got two sisters and a dad with ulcerative colitis. So it is always a soft spot when I hear of people that are really niching in that area. I'm like, that's exciting because I've seen firsthand the ups and downs and the chronicity of this issue and how it's managed in all the different ways. So that's really cool to know. Because
Yeah,
yeah, that frequent bowels can be such an issue for that because there's such
can be.
inflammation and all the rest kind of adding to that.
Absolutely. And we see people who've had part of their bowel removed for bowel cancer, rectal cancers, that kind of thing as well.
Mm,
Those people often don't get referred by their surgeons because I think the surgeons just think, oh, well, the cancer's out. I've saved your life. You're fine now. And they forget about the long term. And that's not all surgeons, but I think it's getting better over time. We're getting more referrals, but I think those people often really need our help as well. They might have
yeah.
had radiotherapy to their rectum, that kind of thing. So that's something we work with closely as well. So there's all kinds of gut issues.
That's a great point to make as well. I wanted to ask you about Kegels because I know that that's what people think of when they think of physiotherapy. They think, oh, I'm doing my Kegels. Do we all need to do Kegels? Is it sometimes bad to be doing Kegels? And from what I can hear, there's a lot more to what you even suggesting potentially as a treatment than Kegels. But talk to me about Kegels and
Kegels.
gut health.
Kegels is a very American term for pelvic floor exercises.
Cool. Yep.
But I think because there's so much online from the US about Kegels, it's become kind of the term that gets used, but it's very American, I have to say.
Yep.
It just means pelvic floor exercises. And what is a pelvic floor exercise? Well, if you can imagine stopping the flow of wee or
Mm,
holding onto a fart, those muscles that we discussed earlier, when you squeeze them inwards and upwards towards the crown of your head, that is a Kegel or a pelvic
mm.
floor exercise. Now, you can do it too much. You can make them super tight by just doing too many Kegels. It's actually, you can hold on to them too long, but some people need to. It's a really tedious balance of like, oh, who needs what.
Yep.
Um, if you have no symptoms at all, you probably can get away with not really doing any, to be honest.
Yep.
The caveat to that is I would say postmenopausal women probably should be doing some because things do weaken in that area as you age. Women post childbirth absolutely should be doing some ongoing, probably for the rest of their lives to some degree.
Yep.
But men, they don't really need to use theirs that much unless they have their prostate removed. So most blokes don't need to worry about holding on to their wee because they've got their prostate in the way. That makes such a difference. Women, we have to use ours quite a lot. It's
Yeah.
actually, I mean, I used to see a lot of men post prostatectomy for prostate cancer, and they would suddenly be like, oh my God, I actually have to like use these muscles all of a sudden.
Yeah.
My prostate in the way. So as a rule of thumb, if you've never done them before and you're kind of like, what should I do? Should I be doing them? Should I not be? How long do I hold them for? How long do I relax for? All that sort of stuff. I think generically, if you can just learn how to squeeze for even just 1 or 2 seconds and then fully relax, completely let them melt away. So often sitting on a firm chair is a good way to do it so that you can really kind of feel the skin. It might only move a millimeter or two, but you should be able to feel a little bit of movement. It
Yep.
should be upwards, not downwards. So people often do them wrong.
Yep.
It should feel like a squeeze and lift around the vagina, around the urethra, around the anus, depending on what anatomy you've got. Maybe a lift of the testes, maybe shortening of the penis, holding onto that area, maybe 1 or 2 seconds, and then fully relaxing, letting it all sink back in towards the chair, letting everything drop back down. That's the kind of movement. If you just did, 10 of those every day, that would probably keep you in some kind of good state, depending on as a basic,
Mm.
I can give this across the internet to everyone. That
Yeah.
won't make anyone worse.
Yeah,
Okay.
for sure.
We often give that exercise as a way of relaxing. So it's a way of contracting and then relax. It's a way that's really helpful for our overactive, too
Yeah.
tight patients. For people who are weak, we might get them to hold for longer. We might get them to do more reps. We might get them to do like little coordination things of like holding and relaxing quickly, that kind of thing.
Yep.
But as a generic, like everyone can do this without
Yep.
screwing themselves up. That's a good way to start. Don't do them on the toilet, particularly when you're passing a stool. It's not the
Oh,
time for them.
for sure.
You can do the odd test of like, oh, can I stop my flow of wee? That's fine.
Yep.
If you can, you've probably got a pretty good pelvic floor. If you
Yeah.
can,
Oh, that's a
you
good
probably
little
need to work
at-home
on.
test.
That's a
Yeah.
pretty good test, actually.
That is, I mean, as I was listening to you, and I'm sure anybody's listening to this,
You're probably all raising
yeah,
your eyebrows to do
100%. I
it
was like, oh yeah, I think I got that feeling, like a bit of TMI, but as if you weren't just doing, whoever's listening, as if you weren't
too.
just doing that. Like, of
I was
course you
doing
are.
it as I
Yeah.
was saying it too.
And you're like, yeah, that's an inward and upward, and you can feel things. Hopefully you can feel things. And if you can't, that's also a bit of a sign. It's like, oh, okay, maybe I need a bit of help. But that's because I just wanted to chat on Kegels or pelvic floor exercises just because
Yeah,
again, that's what's spoken about. So
yeah.
people would be having questions. Now, I guess if you're listening to this and you're thinking, I do need to find a good physio, aside from obviously yourself, which we'll put all your notes and how to connect with you in the show notes, but like, what are they looking for if they aren't in Melbourne or if they, what
Yeah,
is
yeah,
the types
absolutely.
of training and things that we're looking for a good gut physio person?
Okay, so you definitely want someone with not only an undergraduate physio degree, but also a postgraduate pelvic floor certification of some degree. So
Hmm.
most pelvic floor physios have done postgraduate certificate. That's the sort of level that you're looking for. Um, or they've done a lot of extra training in this area because we don't come out of our normal physio degree able to do this stuff.
Yep.
We don't learn about this stuff really at all. So that's as a starting point. You can usually see people's qualifications on their websites, looking for a postgrad certificate at least for pelvic floor training. There's an awesome, awesome website called, and I'm going to look it up on my phone as I've got it written on my phone, cfaphysios.com.au, but I'm just going to double check that and I will put it in the show notes. Well, you can put it in the show notes. CFA Physios, PHYSIOS.com.au.
Yep.
That website is the Continence Foundation of Australia, their sub physio branch. So anyone who has done the correct training is allowed to advertise where they work on that website, and you can actually search by location for
Right.
pelvic floor physio. So it's really good. It's nationwide. There's probably more in Victoria on that website at the moment, but that'll get better. It started as a Victorian-based one. The Continence Foundation of Australia has awesome resources, and they have a hotline. You can call them, and they can also get you in touch with a pelvic floor physio. There are physios working in public settings where it's free to see them. There are ones working in private where you have to pay. You don't need a referral to see a pelvic floor physio generally. Certainly to see me, people don't need to have a referral from a doctor or anything like that. But if they want, for example, a Medicare rebate, they might be eligible if they get a plan from their GP. Not
Yep.
everybody is, but some people are. I used to work in a public clinic at St. Vincent's where they have physios as well as dietitians and psychiatrists and gastroenterologists all working together. There's a few public services around like that. So in Melbourne, the Alfred has a functional gut disorders clinic.
Mhm.
St. Vincent's has a functional gut disorders clinic. I think that Eastern Health might have one as well. There's probably a few others floating around now as well.
Yep.
Those services are amazing, but they have long waiting lists.
Yep.
But GPs can refer to those clinics or other doctors, and they'll get to see the whole team and get a holistic approach. Our private practice has got gastroenterologist, psychiatrist, dietitian, and physios all available for people to see as well. We tend to always work as a team,
Yeah.
and I refer on to other people as well. I often refer to you and to other naturopaths as well, and psychologists and gut-directed hypnotherapists and all sorts of people. But the Continence Foundation of Australia is a really good resource to look up people because that website will have only the people who have that extra qualification. So it's
That's
a good
that's
screening.
great.
Yeah. And they are all over the place in rural areas as well.
Oh, amazing. Because like that's the thing is like because I know that you're in Melbourne, when I've got patients that aren't Melbourne based, like how do I find a good physio? I'm like, I
Mhm.
don't know. Like I
Yeah.
know that like I'm
Yeah.
like, I'm like, do you use the term gut specific? But again, it's like what they say versus their qualifications, that's
Correct.
where we're wanting to make sure that like you've got
Correct.
the rigid edge. Like you want to make sure that you've got the right person.
We also offer telehealth for people who are far away.
Great.
There's heaps
Awesome.
we can do over online on Zoom. Yeah.
Love that too. Now, if people are, on a wait list, and they can't get into a physio, or if they're just someone who's like, okay, I think I've got something wrong with my pelvic floor, are there things that people can start doing today that can help with that whole process and function
Absolutely.
of their gut?
Absolutely. So I've got a few key tips which are kind of very easy to apply to anyone.
Hmm.
My first tip is that pelvic floor squeeze and let go regularly throughout the day. If you think you have a tight pelvic floor, if you think you have a weak pelvic floor, you can't go wrong with either. Squeezing up for 1 or 2 seconds and then fully relaxing, giving it a 10-second break, maybe doing 10 reps. Maybe you just do one every so often as you think of it through the day. Every time you turn on the light switch, you do one.
Yep.
That's a really good starting point to just learning how to let it go and being aware of it.
Yep.
Even being aware of it as you're doing things and noticing if you're holding tension and letting it go. That would be a
Mm.
really good starting point, even if you think you have a weak pelvic floor, that isn't going to make you worse. You can't make it too relaxed.
Yep.
Um, Also, I think like a really solid morning bowel routine. This is something I teach all my patients, and hopefully I'll fix some people who are listening to this just with this one simple thing. Our gut wakes up with us. So when we have all these lovely hormones that help us wake up in the morning, our gut starts really turning on. So the contractions in our large bowel are 5 times stronger in the morning. So you can harness the morning to get you into a really good routine where you have a poo every morning. And what you should do is when you wake up, as soon as you wake up, have something hot to drink.
Yes.
Like coffee, coffee is a great bowel stimulant, but even, herbal teas, hot water with lemon, anything that's warm will really stimulate your gut. Eating and specifically chewing, so not just downing a smoothie as you're running to the car, but actually sitting down and eating a meal. Can be something small, can be something simple, can be some berries, it can be a banana. Eating something, the act of chewing stimulates our bowel. Amazing, right? So it's called the gastrocolic reflex. As you start eating, the colon starts working
Yep.
and starts really contracting and moving things down towards the end point. And being upright and moving around for 20 minutes or so. So I usually say, wake up, have a hot drink, eat some brekkie, then get all your stuff ready for work or school or wherever you're going to. This applies to children as well. And then before you leave the house, allow yourself a good 5 to 10 minutes, and it needs to be that long, particularly 5 minutes for women can feel like forever.
Hmm.
Sit on the toilet and just relax. And if nothing happens, fine, get up and go. But if you do that same order every single day, you'll start to get into a really good habit where you have a stool passing every morning and it will
Oh my
become
gosh.
easy. So that is like my gold nugget for the podcast is do that for everyone.
Oh, I love that. And like that is, there's obviously all the different types of morning routines people are doing these days for their nervous system and things like that. But if your issue is like, I just cannot poo, I'm constipated, like whatever, like that is so great. And like we know, you think about it in terms of that warm water, that warm contents versus that cold. I mean, we know that water
Yeah.
freezes when it's too cold. We know, like it makes sense that the heat kind of starts stimulating things as well. That's
Yeah.
awesome. Would you put into that thing of like the morning routine or just something people can do now is squatty potties? Like, is that
Yeah.
something that you would do as well?
Yeah, so I reckon squatty potties are great. I mean, they're quite expensive, the specific squatty potty one. You can also get, there's generic ones these days on Amazon and in shops, in pharmacies and things. You can also just get a good old like children's step.
Yeah,
Those little kiddie steps that are like $5 at Kmart or Target or IKEA
that's
or
literally what I have. A five
that's what I
dollar,
use.
a
And it's
$5 thing
great. And
from
my kids
Kmart.
use it too. And those are fine.
Yeah.
Elevating your feet and not just going up on toes, I should preface this. Having your feet flat but elevated, your knees elevated a little bit more than your hips can help empty the bowel a bit. It does tend to straighten that rectal angle,
Yeah.
make that muscle relax a little bit. There's a great squatty potty ad on YouTube that shows a unicorn doing rainbow pooing ice creams.
Yeah.
And it shows the muscle. It's actually quite a good ad because I sometimes show it to my patients. It actually shows like how the muscle's meant to be, what the squatty potty does. Great. I mean, you don't want your knees in your chest. You just
No.
a little higher than
You're not in like the fetus position, like,
no, we don't want
sitting
to be
upright.
standing on the toilet seat squatting on it. Like I've
Yeah.
seen some things and heard some things. Yeah, no, nothing wrong with that at all. I think like it helps some people heaps, it helps other people a little bit.
Yeah, yeah.
So
But
it's
not gonna hurt. And also it's
not gonna
probably
hurt.
just good practice anyway. And like with the in the case of like the little $5 stools, like they can just like slot beside a toilet. There's even like a little stepper that like just kind of folds up. So it's not as if you're like, I'm dealing with now this bulky thing that's in my bathroom. Like these things can
Correct.
be quite inconspicuous in your bathroom and just be something
Absolutely.
that you do just for good health. And if you're someone that it's a minor or a major improvement, well, it's an improvement, isn't it? So
Totally.
like good to do.
Yeah.
I love that. And also just clarifying, not on your toes, have flat feet. They're
Feet
things.
flat, nice straight back, lean forwards, let your tummy be completely relaxed. We are not meant to push with our tummy muscles
Mm,
that most people do.
mm,
So most of us, if we're straining, we'll pull our stomach inwards and really force downwards into our bottoms. Our bottoms are not meant to push the poo out. They're
yeah.
meant to just relax and open. And the pressure should really come from widening our waist and relaxing our tummy and opening it out and making kind of a big belly to push the stool out.
Mm,
There's a much more to it than that, but as a
of
basic,
course.
like, just that's a start widening your waist, relaxing your tummy forwards, relaxing your bottom. Don't push down.
Yeah. That's good to know. Again, things that people can look for that may also think, hey, I'm not doing this right. Why is that? I need a bit of help. So that's also helpful. Final question. So, in all of your time working with the pelvic floor with gut issues, what would be your number one piece of advice, for someone that's needing or wanting to get assistance in this area?
Number one piece of advice.
Or if you
Look,
got two.
I'm I think don't keep waiting to get help. So often people say to me, I wish I'd seen you 5 years ago. I wish I'd seen you 10 years ago.
Mm,
Gut health issues really, really affect people's mental health. They really get people down. They make them irritable. They make them depressed. There is such a correlation between the brain and the gut. The nerves in the brain are the same as the nerves in the gut, and they interplay so much. And I think so often people say, oh, I'm anxious and therefore my bowel stuff started. But I think also it can go the other way.
yeah.
Gut issues can really affect your mental health. They can affect your social life a lot. I have people who don't go out because they're worried about their bowels. Get some help.
Yeah.
There are people who can help you. I can help you. There's so many physios around that can help with this. There are so many doctors and naturopaths and psychologists that help with this stuff.
Yeah.
Get out there and get some help. Tell your GP if you feel uncomfortable about it. Try and find a GP that you feel comfortable with so you can talk to them about it. Um, yeah,
Yeah. I think that's solid advice. I mean, often people just don't know, which is why they don't act on it. But I'm hoping that this conversation today has given people something else to consider, not to overwhelm them, but just it is something to keep in mind because, as we've mentioned at the start, food, amount of fiber and water you're drinking really isn't all that you can do for your gut. Physio is something that I think a lot of people need to consider. And you've just kind of given us a million reasons as to why and what you can do to help.
Yeah, well, I mean, hopefully, I mean, I really do think that between the better posture on the toilet, a good morning bowel routine, learning how to relax the pelvic floor, and doing some lovely like abdominal breathing, a lot of people get better with just those things. There might be a whole bunch of people from this podcast listening that just get better with me saying these things and don't even need to see someone. If you do
Yeah.
all that stuff and you don't get better, then come and see us.
Yeah, but like, wouldn't that be magic? That would be the ultimate gift, is that we could give them that, and
I
then
would
again,
love
if they
that.
need to go
Tell
further.
us if that happens to you. We'd love
Yeah,
to.
yeah, yeah. Let us know for sure. Thank you so much, Izzy. I'm going to put your information, how people can work with you, contact you, as well as some of the other things that you mentioned about Your Body Keeps the Score and the CFA website. Oh, gosh, so many resources. You've been so generous. So thank you so much for sharing everything you
Yeah.
know.
No problem. Thank you so much for having me, Rachel. It's so nice to reconnect with you. This
Oh,
is great.
lovely. Thanks for tuning into Gutsy Talks. I hope today's episode left you feeling inspired to take the next step in your gut health journey. If you're ready to dive deeper, head over to rachellarson.com.au. There's a range of courses and resources waiting for you. If you loved this episode, I'd be so grateful if you shared it with others who might benefit from this information. And so you don't miss out on future Gutsy Talks, be sure to hit follow and leave a review. I'd love to hear your feedback. I'm Rachel Larson, and I can't wait to connect with you again for our next Gutsy Talk.